name is Martine Vrijheid. I'm a research professor at IS Global. I'm head of the Childhood and Environment program. So I lead the research group on the effects of environmental risk factors on child health and development. And I'm also the coordinator of the Athlete project. So first of all, we are focusing on the early life period, so pregnancy, childhood and up to adolescence, because we know that whatever happens in early life has a big influence on disease later in life, and also because we know that children and even from pregnancy onwards are already very vulnerable to environmental influences. Now, up to now, most studies and most evidence has been created in studies that look at one environmental pollutant or risk factor at a time. So there's studies on air pollution and childhood outcomes, and there's studies on pesticides and childhood outcomes, and many other chemicals, for example. But there are very few studies that look at many risk factors together. So there's very few studies that take a more holistic approach. And we know that it's important because we're all exposed to a cocktail of pollutants from many different sources. So Athlete is one of the first projects that will put together the data to really look at these cocktails of exposures and how they influence the development of the children and the health of the children from very early onwards. And we feel that it's really important to get that data together so that we can get better evidence on what happens so early in life. One of the things that we really want to achieve is to get together a large database across European countries that allows us to do exposome research. So we are building the longitudinal databases with many risk factors in the environment, from the urban environment, from chemical exposures, from lifestyle exposures, and from the child health outcomes, all together in one database from many different countries. And what I'm really looking forward to is to have this as a resource to answer many questions that come up from public concerns, from policymakers related to environmental pollutants and their effects on health. As I said already, it's really the next step. What we've been doing before is tackling environmental pollutants one by one. In the regulatory system, for example, chemical pollutants are regulated one by one. Air pollution is tackled by tackling air pollution on its own, but we know that all of these exposures are related to many other factors in our environment, and we hope that the exposome studies and the exposome approaches will really allow us to tackle more than one of these factors in the environment, these hazards, at the same time. For example, by regulating mixtures of chemicals, or by making changes in the urban environment that impact not just on one exposure, but on different harmful exposures that affect health. And within all that, we really hope that we can also get better evidence for these effects in early life, so that we can really start protecting children. And this is really the focus of this project, is to focus in on these vulnerable age groups that really need more protection than adults, for example.